Hi there. My name is Dr. Kimberly Ernest. I'm a licensed psychologist, licensed professional counselor, president of Pennsylvania Counseling Services, and founder of Live Up Counseling. And today on the How to Be Happy Hour, we will be talking about forensic services, specifically how we engage in treatment and really support those in the process of community reentry or recovery from problematic sexual behaviors.
Hi, I'm Mel Morgan. I am the clinical consultant for our Berks County family-based team. I'm a trainer, supervisor, and practicing clinician. I'm an LPC in the state of Pennsylvania.
I don't have anything. Hi, my name is Sage. I have a master's in applied clinical psychology, and I am a forensic and mental health therapist here at PCS.
I'm Micah. I have a master's in clinical mental health counseling. I'm an outpatient forensics therapist with Pennsylvania Counseling Services and the director of ministry with Servants Oasis.
I'm Carrie Meeham. I am a forensic therapist, recently licensed therapist within the state of Pennsylvania as well, and developmental supervisor for our forensic therapists.
Thank you. And thank you all for joining me here today. So, just to bring us in, when we are talking about forensic treatment, we are referring to the treatment of individuals with historical problematic sexual behaviors. Once upon a time, this population was very frequently referred to as the sex offender population. And while those pieces continue to be true, we do tend to refer to it more as PSB or forensic treatment in an effort to recognize that these individuals, while perhaps or most certainly engaged in some really problematic behaviors, that is not or does not need to be the extent of the definition of their identity. We have found that through the course of this work, and for the sake of full disclosure, I've worked in the forensic or problematic sexual behavior realm for about 21 years personally. I'm a sex offender assessment board approved certified provider. I, for many, many years, supervised this program and also am a certified juvenile sex offender therapist. I now run quite a few different trainings in this space, and so I would say this is an area that I'm pretty comfortable speaking to compared to probably anything else I talk about on the podcast. So when we're talking about forensic treatment, that can look a lot of different ways, sort of depending on the setting, the client, the community partners, and how we can best align with probation and parole, CYS, some of the different pieces that support the reentry of this individual. So forensic work operates within an ecosystem of services that is designed to support these individuals in successfully remaining in the community while also preventing all future reoffenses. Forensic work is a little bit different than more traditional outpatient therapy. So in forensic work, we wear two hats, we serve two gods simultaneously at times, and we're sort of constantly balancing in between this goal of community safety and how do we need to communicate and collaborate to ensure the clients on our caseload are not putting themselves at risk and are not risking others in a variety of different ways. And then also we're striving towards supporting the individual, the client, the offender, if you will, in recovering from their behaviors so that they have no future offenses. That looks different on client by client. I think it's also really important for us to define problematic sexual behavior because that is a huge range. So we have everything from non-contact offenses. That can be everything from looking at child pornography, creating pornographic images utilizing AI. It can be sending unsolicited dick pics to people. It can be masturbating to the point of injury with an intellectually disabled child. So it's really important to recognize that problematic sexual behavior is not only sexual offense behavior, is not only legally criminal sexual behaviors. It can be. Oftentimes it is, but it exists on a continuum. And it's important for us to recognize that range of offenses so that we can better understand, treat, and serve this population. When we are navigating problematic sexual behaviors, we have those non-contact offenses. Prior to that, we might have some reactive sexual behaviors. So that's more readily defined as individuals, oftentimes children or adolescents who have experienced a sexual trauma that go on to act out sexually. So that would be the definition of reactive sexual behaviors. Then we have non-contact sexual offenses, and that can go all the way up to contact or even violent sexual offenses involving touch and coercion and everything in between. I don't say that to create any other space than to recognize that we are navigating a continuum behaviors, and each individual involved in forensic services needs to be evaluated and assessed based on their strengths and challenges, and recognize what would be individual risk factors for that person. So, for example, some of our offenders, some of our clients, some of the population that we serve have a particular preoccupation or interest in sexual interest in those significantly younger than them. In those instances, when we're navigating treatment services with those individuals, we have really big eyes for safety when it comes to contact with minors, supervision when they have contact with minors, and may even recommend no contact with minors. Alternatively, some offenders have historic charges online. Maybe they had child pornography charges, maybe they were seeking sexual relationships with minors on the internet. In those instances, we may recommend that these individuals not have access to the internet, not have access to social media, so on and so forth. So it's a very individualized assessment and recommendation process. We have adult and individual services, and we sometimes work with individuals as young as 8, 9 years old based on the continuum of ages that we see. We are heavy proponents for the inclusion of the family system when it comes to treatment. Or any sort of ancillary community supports. We do not see 1 to 2 hours a week in an outpatient setting being nearly sufficient enough to support community reentry, especially following a period of incarceration. So we are heavily looking at how we can coordinate, communicate, and collaborate with probation and parole, CYS, case managers. We also want to collaborate with natural supports whenever possible. Wives, partners, adult children, clergymen or community members. We've worked with employers. I don't know, y'all, throw in, are there any other community partners that we've collaborated with more regularly?
Faith leaders, so like pastors or deacons, have come in to support as well.
Coaches. We've had coaches come in. Any others that I'm missing? Okay. But often, and really, we'll work with whoever will be a positive support. So, what a close friend, a colleague, whatever that is, we are here to wrap around the individual because ultimately we want to work ourselves out of a job. We do not wish to be their sole source of support, but we want to slowly transfer those skills to other more natural supports within their community so that we can titrate services and ultimately successfully discharge. Forensic services exist in a variety of different settings. Many are in an outpatient setting, and that's very traditional outpatient. So individual evaluations, individual therapy, group therapy, or family or support, like partner support sessions can exist in that setting. We also tend to, and have for many years at Pennsylvania Counseling Services, treated adolescents with problematic sexual behaviors through the model of family-based mental health services, which is a home, school, and community service that's very intensive and designed to prevent the out-of-home placement of a child. We can speak more to that as we move forward, but those are our two primary modalities. Adults pretty much are treated in an outpatient setting, though we do some work release, as well as we have several groups and programs that operate within the walls of an institution as well, so that they can do some of this work before they end up back into the community. A few other pieces, we use evidence-based practices, so we use treatment modalities that are consistent with theoretical orientations that have been clinically proven to support this population. So we use ESFT and family-based combined with evidence-based curriculum. We also use a lot of evidence-based curriculum in outpatient. So many of those are more cognitive behavioral in nature, but we have workbooks that work for adolescents as young as like 10, 11 years old, and then go all the way across the lifespan. We have workbooks and curriculum that we use with women. We have workbook and curriculum that we use with those who specifically struggle with like reading comprehension and different things. So broad range of services. We also use a couple of other resources along the way. So at times we will use therapeutic polygraphs to address denial or sexual history. We also work with other supervising entities to have supervision software and support individuals in putting some of that on their technology or on different devices to make sure some of those behaviors diminish. So I think, according to my notes, that's basically our 10,000-foot view, but y'all are the experts. Y'all are the ones doing the work day in and day out. What did I miss, or any pieces that I just glossed over that would be helpful for us to lean into so that individuals can understand what the service is, so that clinicians can maybe better understand whether or not this would be a fit for them for their next season of career, or so ultimately community partners may recognize whether or not our model aligns with their vision for community reentry.
I mean, I would say probably the engagement of the family system. So a lot of the work that I do is with children and adolescents and their families through the ESFT family-based model and then outpatient. But I think that across the lifespan, I think family engagement is really important. And so oftentimes there's broken trust, there's shame. There's a lot of things that kind of go into the relationship. And I truly believe that the relationship is the thing that we as humans, we seek that connection with others, especially our families, the people who, live in our home, the people who, have been a part of our lives ongoing. So I think, if that family work is something that interests like an applicant or even somebody who, they have a loved one who's seeking treatment, like what is their role in treatment? I think that that's a big part of the work that we do.
I'm also thinking one of the things that we do often in a couple of different ways in order to bring some consistency to what treatment looks like is we have certain specific consistent practices that we go through paper-wise, like reunification. We've got relapse prevention plans. We've got event permissions so that we can get into the rhythm of we really need to slow ourselves down. We need to think things through so that we can see the success and growth that we hope to, not only for them, but also for the safety of the community.
Well, and part of that slowing down process is hopefully to support the client in identifying risk and protective factors so that when they're no longer involved in treatment, when they're no longer under community supervision, when they no longer have an open CYS case or, whatever other artificial layers of protection they're currently operating with under, hopefully going through those processes allow them to start thinking things through so that they can make safe choices when they're no longer involved in these services.
Even long term too, what I've tended to notice is you'll see guys who are irritated with the process at the beginning.
Oh, for sure.
Understand.
They're never happy at the beginning in any way.
Always resistance to start.
Always.
But what you'll notice over time is, or at least what I've noticed over time, is that a lot of the guys that I work with will start to ingrain those processes into their ways of thinking rather than just on paper. And so before they're even coming in with, hey, I need to do an event permissions, they're already thinking, okay, I need to make sure that I'm doing this right, and I need to make sure I'm doing this, and I need to be aware of this. And you really start to see a shift in mindset from people who are fairly unaware of how to stay out of it at the beginning to, okay, this is what I need to do to maintain my success and to keep myself out of the places I don't want to be.
I think one thing that's helpful to note, though, is also that while we are focused on the forensic side of the work that we do, we also take into account mental health concerns, and we can integrate the two things together to help the client learn how to navigate and manage their own symptoms, along with how it might be showing up in these problematic behaviors that have arisen. And so I know that's something that has come up in questions from community partners a lot of times, like, oh, we need a mental health assessment in addition to the forensic assessment. And so the fact that we can integrate those two things when we do our evaluation, is helpful, that the client doesn't have to go out and seek out another service on top of our intensive services. And so I think that's helpful for those that are listening to know.
I love that you bring that up, and I really appreciate it, because I also know there have been times where we've received like pressure from community partners or clients saying, well, I've been in forensic services for a long time, and I would like to titrate or step out altogether. But then they have these other more acute mental health pieces. And I can think of a client that's been in services with us for many years in Dauphin County. And this individual has certainly, I think, gotten what they can gain out of forensic services, though I think based on their specific constellation of symptoms, they have really struggled to internalize some of those rules. So while he's been stepped down and he's been like successful in treatment, and we've given all that information to his community supervision, he still chooses to remain in treatment bi-weekly. So he doesn't come weekly anymore, but he's basically said, I need the gut check. I need the support. It's really good for my mental health. He doesn't have a lot of more natural supports within his ecosystem. And so we had actually titrated him down to once a month, thinking this is what he really wanted. And he came back in like 2 months later and said, can I come back more frequent? Like, can I go back to, now does once a month individual, once a month group? And he said that's been really good for him to, hey guys, I have this idea that I want to do. And they're like, that's a terrible idea. And he's like, thanks for telling me. Like, it just serves as a gut check. He's recognized that despite his best efforts, he has not been able to address some of his thinking errors, and they continue to show up for him in a way that is dangerous. And so he remains in services. I think there's also times where I think you had a client that we were unwilling to step down because they were struggling with some acute mental health stuff. They were struggling with some suicidality. And we said, while we understand the forensic pieces are more under control, we can't, in good conscience, we're also licensed mental health professionals or a licensed mental health facility. We can't step you down when you're not safe.
Yeah, and just the ability that we can individualize and customize. While we do rely heavily on specific curriculum that has specific components to address within the curriculum, we apply it in a very individualistic way to meet the needs of the client. And of course, if they need other services like drug and alcohol treatment or case management, we can refer out, or family-based out of the outpatient, and vice versa. So we can really tailor and customize to the needs of the client.
That's really nice. We can also add prescribers.
That
We can
too.
refer for
Yes,
prescription services if
absolutely.
necessary.
Yeah, I think something that's like Kim, that you were saying, that's really important in this field, especially if you're looking towards coming into this field, is the understanding that like we act as a very strong support for these people. A lot of the times, like as you had mentioned earlier, Mel, that like they don't have a lot of support at home. I find for me, I work with adults and I work with juveniles, and a lot of the times the juveniles don't feel like they have the support from their parents, or the support, they don't want to tell their friends what happened, they don't want to tell their siblings what happened, but they feel that they can come to me as a consistent support for them to be able to work through those things and talk through those things. And so not only are we kind of providing a consistency for them that maybe they didn't have before, like that in turn is going to become a protective factor for them later. So I have juveniles who will stay for mental health after they've completed the program because they're like, I really enjoy coming here. I know that I don't have that support outside of here. And like, I know that I can trust you to be able to work with you on things I'm feeling, because being a juvenile in today's world is very difficult, especially with the access to technology that they have. And so it's not like, it's important to know that like, yes, we are providing a service that is evidence-based practices, and that seems difficult in nature, like from what it is for certain people and how you view this population. But ultimately, we're doing what we were taught to do in school, and that is be supports for people in any phase of their life. And I think that is a very important role for us to remember when it comes to like who we're working with and what we're doing. It's like ultimately we're being a consistent support for someone who maybe didn't have that.
No, and I love that you bring that into the room because while we just joked that so many of them come in reluctant, and I mean, how many times have I had clients out the gate be like, fuck you?
Yeah.
Like at intake. Like we
Yeah.
just met and they, fuck you. I hate you. I hate your face. You're a cog in the wheel of a system that's designed to abuse me. You just want my money, which is so funny.
Yeah.
So much money in this field. There's no money in the field. So I love though that you mentioned that because it does often start there. It rarely ends there. It does end there sometimes. Like there are times where the client never quite recognizes the value that we add to their lives, but so many of my clients over the years, and even prior to that, I remember when I started in this field 20 years ago, one of the groups that I observed in the very beginning was an entire group of individuals that were no longer mandated. It was a step down out of the mandate, and they had identified more as a sex addiction group. So they were individuals that may have a history of sexual offenses throughout their narrative, throughout their story, but they had gone through the process, completed their mandate, and they were like, you know what, we need this, and sort of on their own volition said, we want to do this thing, and that's where it ended up. And it was a beautiful group that ran for many, many years out of our Harrisburg office.
Yeah. I think like even in the greater community, right? Like I also work in the DA world, and so like you can go to AA, you can go to NA, you can have a sponsor. There's still stigma around it, but not as much stigma as somebody who struggles with problematic sexual behaviors. So like something that I oftentimes like will say is how isolating it is even for the families, like for the caregivers. Like you can go to your neighbor, to other people, like and be like, hey, my kid did this great thing. My kid's struggling in school, but if you say like, my kid's created or my kid engaged in a sex act that he's now facing criminal charges for, that shuts down the conversation pretty quickly. And so I think, being able to create like a sense of community and being able to create like an understanding, even what are the resources that are out there in the community. There's a lot of access now, like, technology has its challenges, but there's also the benefits of technology where parents can connect with other parents who are going through a similar situation. Kids can connect with other kids in a safe manner. Schools, I think, are one of our biggest like untapped resources. So how do we get schools to have conversations? How do we get parents to have conversations with their kids? So I think there's a lot of like, it's not just the sitting in the room talking about like what led the client to sit in the chair across from you in that space, but I think there's a lot of like opportunity to kind of reach outside of just like that initial session.
Yeah, I definitely can relate to that, Mel. It makes me think of the juvenile population that I work with, especially. Because I work heavily with them. I lead a juvenile therapy group with problematic sexual behaviors, as well as doing individualized treatment and working with the families. And I've noticed that with each of those juvenile clients, that there is a level of maturity that occurs as they progress through the treatment, as well as usually some level of reconnection or strengthening connection with family members, which may have been a part of why they, are sitting in the chair across from me, is like seeking out that connection and support, while it be in some problematic ways, right? We find the healthy ways for them to engage in connecting in a really healthy, positive way. And so that's been really fun to watch the growth that happens throughout treatment.
I think what's cool too is that like research has shown that kids and adolescents who engage in problematic sexual behaviors, even like adjudicated youth with the proper treatment and completion of treatment, usually don't go on to further commit crimes like sex crimes. So that's, I think for me, a lot of the populations we work with, right, we kind of see this like cycling that could potentially happen. So it's kind of the thing that that I think I anchor on, like during the hard days, is like, yes, this is really hard and this is difficult work, but also it's worth it. There is like research to back up that good treatment will allow them to grow up.
And I want to like put an exclamation point after
Yeah.
that, because I think early career clinicians and even more seasoned providers have no idea how unique that is to serving the adolescent PSB population. I do a lot of interviews for individuals seeking to join PCS or live up in different capacities. And a question I ask everyone is, what is a population you love working with, right? Because I want to find the right ecosystem of providers I think we do our best work in populations that spark joy for us. But I also ask, what is a population you're uncomfortable or unwilling to work with? And sex offenders is the answer I get often
Yeah.
in that space. And they fail to recognize, I think it's predominantly people have this stigma or this erroneous belief that once a sex offender, always a sex offender. And that's plainly untrue. And the data suggests, by and large, individuals that receive treatment and successfully complete are way less likely to recidivate than when you look at other common legal challenges or even other common mental health challenges. Like adolescents with PSB, way less likely to act out sexually if they successfully receive treatment, versus adolescents with depression, way more likely to have recurrent depression throughout the lifespan. Not throwing shade, just saying, if you want a treatment that's going to be like done and dusted, it's a good one to consider.
Yeah, when parents come into the office, at intake, a lot of times they have such a level of fear and worry
Hopelessness.
and hopelessness. Yeah. And I give them that little detail, that little nugget, that shred of hope. And it's like, wait, what? Like, this doesn't have to be their life. This doesn't have to be a label that they have, and I'm like, yeah, juveniles, there's a whole lot of reasons, what leads them to offend or act out. But yet, through therapy, through treatment, they can have a different story as they navigate and move into adulthood. So,
Kim, you were saying about how sex offenders are some of the higher of what people want to stay away from
Yes.
in treatment. And I can, in some ways, at the beginning of my journey with this, relate to that, because I can remember thinking back when I started my bachelor's program, hell no, I'm not I'm not working with sex offenders. I mean, that was the top of my list. And so when I got to the level in my master's program, when I was interning and got to start with PCS, and that was what was offered to me, I was like, I don't know if I could see myself doing this, but I took it. And I was incredibly thankful and grateful of how much easier it was to have compassion for these guys when I got to hear the full of their stories, that it wasn't just what was projected, but when I was able to sit across from them and hear their experiences and sometimes hear the regrets, sometimes not hear the regrets, but maybe hear them later. But it was so much more easy to have compassion for them after giving them a little bit of a chance, which I didn't at first.
At the end of the day, healthy, well-adjusted people don't commit sex crimes. And so if your life has been sunshine and roses up until this exact moment, it's pretty unlikely you're going to go out and sexually offend on another. And so if you can hold lightly their behaviors and look at their histories and their narratives and all the different ways in which the stars aligned to bring them to the doorstep of problematic sexual behavior, and then all of the patterns and risk factors that allowed them to walk through that threshold, if you stay in that space, I have never had a hard time finding compassion. I've had a hard time hearing the stories. I have struggled with it is a fundamental part of the work. You cannot do this work without having people tell you the harm that they've caused to others. So, and that is hard. Those are hard days. That is not all this work is, though. It's a part of the work. It's a component of the work. But if you look at all the other pieces, I think the compassion comes pretty easy, or at least it always has for me.
Yeah, it definitely did for me. And Micah, I can kind of relate. I guess when I came into this field, I didn't have a direct population that I knew I didn't want to work with or wanted to work with. I I wanted to work mostly with trauma.
You've been interested in serial killers since you were a child.
Yeah,
though. So
which,
you were
I guess
coming
you could
here.
say.
You were baby stepping your way to forensic services.
I will concede that. But I had the pleasure of being able to watch Carrie's juvenile group as one of the first things that I got to shadow, and I think that is what made it so easy for me to just fall in line with this work, because I got to see. I know it's wonderful. I was so sad when I left the group, but I got to see like these kids who don't have peer support or they can't tell their friends, like create a community in this room. And she did such a wonderful job. And like, I got to watch them heal as children, and then working with the adults, like part of me was like, that's them too. Like they came from this. And so like healing the inner child for them as part of their treatment now as adults, like seeing the kids be worked with helped me to be able to work with the adults too, like to offer that compassion on both sides. And I just kind of like slid into the role, and it may be selfish, but I find the work to be very rewarding. Like I think that it's very awesome. It's sad because I love working, especially my juveniles. I love working with my juveniles. And I always tell them, like, listen, like, I love seeing you. Please don't end up back up on my couch. Like, don't come back to my office unless it's for mental health. Like, that's great.
I like you enough, though, to hope I never see you again.
Yeah, exactly. And so, like, it's rewarding to see, like, the progress that they make and to get to see, like, the changes and have their parents be like, oh my gosh, like, I can't believe how much this helped them. Like, they're totally different kids than when they came in here. And then, like, go out into the world and, like, know that they are doing something that is like with their lives. Like I have a kid right now who wants to be an aerospace engineer. And I'm like, you go, like you are going to be able, like, this is not like the only chapter of your life that you have left. Like this isn't the end of your story. Like you have so much left to live. And I feel that same way about the adults too. Like this isn't the end of your story, even though you're in your 60s or 70s. Like you still have time to live the fulfilling life that you wanted. And like I love being able to be a part of the work that gets them to feel like they have that, they have a reason, or they're allowed to. Because I think a lot of times for them, they don't feel like they are allowed to be able to enjoy their life. And I like being able to bring that back to them, to tell them like, it's okay. Like you can be happy even though this occurred in your past, kind of thing.
I would say most people who do the work kind of stumbled into it. I remember my interview from 10 years ago, and it was like, what's the population you don't want to work with? And I was like, the aging population. That's what I
love
said.
working with that.
And I was like, and like now I'm like, I don't even think like forensics, people with problematic sexual behavior was even like on my mind that was like a thing. Like, I mean, honestly, like
You would have said it.
I probably, and truly, I think a lot of people, even, the staff that I supervise, it's kind of like you start working with a case, and then, at least kind of in my world and like the family-based world, you start working with a case, and then you start realizing the problematic sexual behaviors, the potential to offend, or that there has been an offense that has occurred. And then you see the story. And then you see, the hurt in the family, you see the hope that they don't see at that point in time. And so for me, that's kind of how I started with the work. And then some of the clinicians that I supervise in our family-based program, same thing. I think we all say, like at least, like on my side of things, I never thought I would work with this population.
And then you're presenting at a national sex offender conference a couple weeks ago, right?
Yeah. So, and you just kind of fall into it, and it's all about knowing the story. I always say that my lane is to provide the treatment and the treatment interventions and the therapeutic support. My lane is not to provide that judgment. And so I think that helps to... it helps others maybe to understand, like, I know where like my heart and compassion lies, but also like, others don't usually understand it. So,
And our lane is very specific because we work like with this population. There are several other involved professionals.
yes.
And so staying in our lane is also really essential because we do work with probation and parole, which community supervision, like that's their jam. We don't want to overstep. We work in collaboration. If
Right.
we are aware of some really high risk factors, we're going to communicate that to probation and parole. If they're aware of some more treatment focused factors, they communicate it to us. And there's a really strong level of mutual respect there.
Yeah.
We don't end every session and call up the PO and be like, hey, let me tell you what, blah, blah, blah. Like, we don't do that because that would belie our effectiveness as treatment providers. But if, Johnny Doe says, hey, after this, I'm going to go babysit a 6-year-old, then I call the PO and
Right.
say, hey, that can't happen. Or he wants to go to Taylor Swift concert. No, thanks. Not on the cards. And so that's where we communicate. I think it's also important for us to mention, we haven't yet, we also collaborate a lot with treatment courts. So I know especially the juvenile systems more and more have treatment court inclusion, but we're seeing it with the adult populations as well. Not as much with adult forensic populations. I truthfully am not aware of like an adult problematic sexual behavior treatment court model operating successfully anywhere. Okay, nobody else knows of anything either. I do know several juvenile programs now utilize a treatment court model, including the one that y'all use in York County, right?
Yeah, and it's great to be able to collaborate and work alongside our community partners. Historically, we focused on punitive consequences for those that have committed a sex offense, without thinking about how do we rehabilitate and bring them back into the community and reintegrate them in a healthy way. And, so I love that that's our role in the therapeutic setting to kind of help them and guide them back into the community, to reintegrate them, to help them be safe moving forward, and so that the community can feel safer as well. So
I definitely don't envy probation, and parole, and the
Lot of
job that
respect.
that they have to do.
Huge kudos to our forensic community partner and CYS. I wouldn't.
Yeah.
Oh,
There's a
yes.
reason I'm not a child protective services case manager. That's really hard work. But I do think it speaks to our effectiveness in the role is that we walk a line of community safety, but at a certain point at that line, we pass the baton. So there are times where we have to make a mandated report. There are times where we have to let CYS or probation and parole or even the courts, we get called in to testify at times. And so we may need to go in and testify and say X, Y, and Z is happening. I think it's also important to recognize that if a client is doing really well, we do the exact same thing. If I have a client that is nailing it, that is out there doing the work, focused on their recovery, having meaningful accountability partner sessions, having successful polygraphs. I'm also making sure their community supervision has those details as well. So we're not just here to, my 7-year-old calls me a snitch all the time now. And I don't think he knows what snitch means because he told me I was a snitch because he caught me earlier this week hiding in the bathroom eating a milkshake once I put them to bed. And I've had to define for him that actually he's the snitch because he's the one that caught me and told our whole family. But anyway, neither here nor there. This is not snitches, right? We are here to say when you're doing really, really well. We are also here to say when you are not doing really, really well in service of community safety. And it's important to say community safety is also what's safest for the client. That client going on and committing a sexual offense, that client going on and harming another person is not good for the client either. And oh, by the way, in an instance where they could commit another offense is also an instance where they, as an identified sex offender, are at risk of being accused of committing an offense. And that is also unsafe to them in a variety of different ways. And so when we talk about community safety, we're talking about community safety for all, not just the offender versus community safety. We enlist them as one of our co-conspirators in creating community safety because it's also what's best for the person involved in treatment.
Yeah, absolutely. When I describe some of our recommendations in terms of things that we ask the forensic population to abstain from, or like you said earlier, no contact with minors or supervised use of the internet, however that looks for them, that's exactly how I explain it. Like, not only am I protecting the community, but this is also a protective factor for you. Like, the last thing that you need is either another offense or to have someone accuse you of another offense. Like, that's not going to benefit you in any way. So out of like an abundance of caution for your safety and your ability to be able to go on and go forth after this, like, we ask you to abstain from these things so that you can be successful and then you can reintegrate later, like into those certain like areas of space, like amusement parks or, Taylor Swift concerts, like later down the line.
Kalahari,
Like,
pool parties, it's all there.
yeah, like that kind of thing. So that's exactly how I describe it too, is it's for everybody's safety involved.
And teaching them to make unquestionable decisions. Like, no matter what got them to treatment, all of them made a series of questionable decisions, whether they did something or not, that led them to getting charged with what they did. And so that's often a way I'll frame it, is how do we make it so that you guys can make decisions that are unable to be questioned, that you can function in such a way that allows you to be successful to the extent that you don't have the ability to be questioned like you were before, to find yourself in the place talking with an FBI person that then gets you charged with conversations with a minor.
Yeah, absolutely.
I agree. What would you say are some unique challenges that face this population? So we've talked about the treatment, we've talked about the modality. When it comes to working with PSB specific groups, what are some things that you've noticed that you've needed to have big eyes for that's unique to PSB compared to other types of treatment?
I don't know that it's unique to PSB, but there's a lot of distrust for us as providers, like especially coming in. I get, especially from parents or from the adults that I work with, like, why are you doing this? Why, like, what's the point of this? Why are you talking to probation? Like, oh, you're just going to go tell probation everything I say, like you mentioned earlier. And it's like that I have to explain a lot, even to people who've been in treatment for years, that like, no, I'm not calling them up after every session. Like, I'm not out here to get you. Like, I don't know that they're out here to get you, but I'm not them. I can't determine that. But like, for me, it's not about like, I'm constantly trying to look at what you're doing to get you in trouble. Like, my goal, if anything, is like, as much as I want to work myself out of a job, I do like being paid. So like, it's nice to have clients, like, you know what I mean? And so it's like, my goal is not to just like send you away right away. Like, that's not how we get people to be able to reintegrate successfully. Like, allowing them an opportunity to go out in a space where they know they have a support backing them up as they're relearning how to be in the community. Like, I'm never sitting there going like, oh, what is Joe Smo doing today? That, like, I can make sure that I put him back into prison. Like, that's not what I'm thinking. So I think a lot of it comes from having to overcome, like, helping them overcome that level of distrust that they automatically have for any kind of provider, especially knowing that we work with the community supervisors that are able to put them back in prison at the drop of a dime.
For sure. I think another piece I've noticed is it is a population of heavy manipulation. So constant monitoring of manipulative behaviors, whether it's towards you, whether it's manipulation in a group setting or triangulation between community partners, it's incredibly important to be aware of. And I know in my own monitoring of that, I always have to keep a certain self-awareness so I don't have a cynicism towards clients, because I think cynicism and skepticism are two very different things. I can have a curiosity behind it without being cynical, but if I become cynical then to clients, I'm not caring for them in the way that I'm supposed to.
And I think that speaks to why we have so many different processes to slow down treatment, because I'm not just worried about your potential manipulation or triangulation. I'm also worried about, I've done this work a long time. I've been lied to. I've had my heart broken by clients who have gone out to do some not great things, and I've sort of bought what they were selling at the time. And so I think also when you're a provider that serves this or any high risk population, it's going to change you and it's going to impact your perception, maybe not just of your clients, but like humans in like human. Like when my kid is like, "Hey, I want to go have a play date with so and so," I'm like, "Yeah, what's mom's name? What's dad's name? Do we have an approximate date of birth? About how old do we think they might be? All right, yeah, give me like 15 minutes. I'll be back. Yeah, and I pull their docket and we see, and I think that is parenting in 2025. I'm not. And if a parent wants to look me up, you do you, boo. I don't blame you. I'm also happy to discuss everything from in my that associates with a home and safety, right? Like, do we have dogs in the home? Sure do. Will one bite you? Maybe. I'm not sure. He's not allowed around strange kids. So I think it has to do with like safety within a household setting. So but it's also designed to protect us from our own skepticism and make sure also we treat every client fairly because of how individualistic it is, and because some clients are really likable but maybe not making progress, and then other clients are making progress but potentially are not terribly likable. We want to make sure we're treating each person equitably and evaluating their progress on a certain metric while also treating them individualistically. And so again, like you're kind of doing a dance there, but I think we do it well by slowing things down, having layers of supervision and consultation. I think some of our early clinicians struggle with that at times because they're like, "Well, you don't trust my judgment." And it's like, I don't. Sit with it. I don't. Just like I don't trust my judgment. When I'm signing off on things, Danae reviews them. Susan historically reviewed them. So I'm not asking you to do anything I don't do. I'm simply saying a layer of checks and balances with this population is essential for a successful treatment course.
I think that. Oh, sorry. Go ahead, Carrie.
Oh, sorry. It made me think of in family-based, they talk about the parallel process, right? And so just as we're asking our clients and their families to be accountable, like us as therapists, as clinicians, like we are holding ourselves accountable, right? With those layers of supervision, with the monthly meetings that we have, right? Those checks and balances. Because even though I'm not required to have like a certain level of supervision now that I'm licensed, I actually seek it out because, I want to continue to hone my skills. I want to make sure that I'm not missing, something that's like a blind spot for me. And having other eyes on it, just really helps, to keep myself honest, as well as, getting to help supervise other clinicians and being able to help them see their blind spots, and make sure that the client, is getting the quality of service that they deserve. So.
Yes, Carrie has definitely picked out some of my blind spots through supervision.
I do.
But yeah, I'm
That's the function of supervision.
Yeah, what I was gonna say too is that I think it was I don't know what cards aligned, but I think it was so beneficial for me to land in this spot coming out of my degree, because I think that aspect of having someone to do those checks and balances for you has been so beneficial to my growth as a provider, because I'm learning a lot of things about myself that I didn't realize that I had, the inherent biases or inherent things that, for instance, if I have a juvenile whose parents are not very supportive, that's a thing that I tend to hold a bias towards, because that's something that I just don't agree with. And so having a supervisor in Carrie, I've talked to Danae, I have other supervision too for LPC, having all of these people that they can look from an outsider's perspective who's not actively built a connection with the client has made it so much easier for me to pick out what I know I need to work on and what I need to continue to learn as I progress through this field. It's just been incredibly beneficial, and I think it's made it better for my clients in the long run, and hopefully all those to come as well.
Yeah, and I think that's really good. You bring about some good points, Sage, and knowing that as a clinician that might be considering coming into this field, there are layers of support. You don't have to do this work alone. I think that's a big fear, is how am I going to work with this population? I mean, this is not discussed much in society, dealing with problematic sexual behaviors. So you can imagine it's not discussed, in graduate school very much either. I mean, I took an addictions course and chose to do my research on sex addiction.
Same.
When everybody else is looking up drugs and alcohol, not that that's not beneficial, right? But there are process addictions out there, right? But you have to seek it out, and it's how do I get the support? How do I enter into this work? And so the fact that we have such good internal supports in place, you don't have to do this alone.
Definitely.
So.
I think also like speaking to the training side of things, like we offer a lot of different training opportunities, and oftentimes I think there's a curiosity in the individuals who like attend the trainings, but also that hesitancy then to fully like engage in the work. Like I did a training yesterday. I was like, anybody have a case example? Anybody have anything? And it was like silence. And I was like, and then people said like how helpful it was to have the information. And so I think oftentimes the label of forensic treatment or the label of problematic sexual behavior sometimes like is like like it's scary, but oftentimes we are treating these these needs in a regular mental health outpatient setting or in family based. We're just not like putting that label on it. So I think that if it is something that just like interests you, having the conversations, like what more would be the things that I would be exposed to? What are those levels, like those layers of support look like? How do I build a relationship with my supervisor? Like I know I can go to Kim and be like, Kim, this thing, and like it's a judgment-free zone, even if it's like the most like difficult thing for me to say, or all my various like supervisors, the group that's kind of created also in like the forensics world, and I think that that's something early career clinicians alike, just like more established clinicians. I've been in the field for a long time, and I think that supervision and being able to seek supervision, seek training opportunities. Every time I'm doing research or training, there's something new that pops up.
Changes constantly.
AI, is a whole new thing, and like just the layers that are there. So I think this work is also for somebody who just like constantly has that drive to just like learn more and have those different layers of support and how to and want to utilize and seek that ongoing consultation.
It's funny you mentioned the training pieces, and I obviously train in this space quite a bit as well, and it's always really well attended. Like really well attended. I'm offering a PSB specific training in July, like a mini lunch and learn.
Yeah.
I looked the other day, I think I have like 70 people signed up for it. I guarantee if I open it up for like a case conversation, I will get crickets. Because it's one of those things where I think you don't get much training with it. Like I was looking for my college transcripts the other day, and I think in my doctoral transcript, I have 122 credits. I did not get a single credit in human sexuality, healthy sexuality, problematic sexual behavior, treatment of behavioral addictions, sex and love addiction. Like maybe in my couples classes, we had 1 or 2 classes on healthy sexual relationships within the context of couples therapy, or recovering from the aftermath of an affair in the context of couples therapy. But no one taught me ever, how do you recover in the aftermath of an affair if the affair was with your daughter, or if not an affair, but if like the affair is your partner abusing your child or your partner abusing another, and that's a very different dynamic. And I have been called numerous times over the course of my career to support a couple in navigating that exact scenario. I want to be clear. I was not calling sex abuse an affair. I was making a false equivalency there to illustrate a gap in knowledge. So just to be clear before someone's like, no, she's not. Came out wrong.
I definitely think it's an area that is lacking when it comes to the curriculum that is across the board. And when you're looking at college classes, for like my master's degree specifically, it was same boat as Carrie. Like the only class that I ever had anything on was the addictions course. And the only reason I had anything on it was because I'm the one who brought it to the table. So I was working at that time in my internship with this population. And so I got to be the person in my internship course and my addictions course who got to bring forth the knowledge from this population that otherwise everyone who was in my group, like in my cohort, would have never gotten because it wasn't in the curriculum. Human sexuality was not in the curriculum. I took a class on it when I was in my undergrad, and that's not going to give you the information that you need to
I
work
got
with
to
these
teach
people.
that undergrad class several sections though, and I made it about that. I had so much fun doing it.
Good. But yeah, I had to be that person because it wasn't incorporated. And am I the person who should be doing that? Probably not. But like it was great for me to be able to show people like that you can work with this population within this field. Like even though we aren't given that specific information, because there is so many training opportunities and so much supervision, so much ability to move and progress through your career just with the support that's here, and not just from this degree that we have behind our name.
Yeah, I mean, I would say a lot of like the videos and resources and stuff that we pull for training are like international. And like,
They do it better. The
yeah.
Kiwis. It is. It's people
Yes,
from
that commercial. That's what I'm
It's the
thinking.
New Zealand, but they have New Zealand in general,
Yeah.
like is lapping us when it comes to healthy sexuality, PSAs. They have an entire website devoted to supporting adolescents with autism and problematic sexual behavior.
Wow. Yeah.
What do we have?
Right.
Don't answer it. That's not this podcast. So obviously, this population, working with the PSB population, has a whole host of additional challenges that isn't necessarily always unique to the PSB population, but they have extra layers of it that I think compared to other treatment populations or even other community reentry populations is a little bit different. I think this population in general tends to be far more isolated from natural supports and community supports compared to maybe those returning to the community after a drug offense or even a different type of violent offense. This population tends to, even while within the walls of an institution, be in like protective custody or be considered more of a protected class, or try to withhold details about their offense for their own safety while incarcerated. I think this population tends to have longer tails while within the community. This population tends to have a more difficult time getting a job, obtaining and maintaining gainful employment. This population tends to struggle a little bit more when it even comes to housing that they're permitted to have or employment settings they're permitted to work within, because we don't want them working within certain environments that's not safe to them, that's not safe for the environment. They can't live within certain, like Lebanon County. If you're in the city of Lebanon, you are within like 5 minutes of a school, no matter where you live, within the city of Lebanon. So right there, that most of the affordable housing in Lebanon County is not available to this population. So there's a lot of different challenges specific to treating these folks. One of my big questions is when it comes to the curriculum or some of the content of the work that we do, with adults or juveniles, recognizing the content's a little bit different, but there's a lot of similarities or general themes that we touch on. From y'all's perspective, what does the treatment look like? Like, what are the things that we're talking about? What are the things that we're doing? Because I think folks probably imagine that behind closed doors, we're sitting there talking about sex and sexual behaviors. And we sure are. Sure are. But it goes so much further beyond that. So let's flesh out those pieces. Yes, we talk about sexual history. We talk about sexual narratives. We talk about risk factors. We talk about offense cycles and exits and safety planning. That is all a part of the treatment. But what else do we do? What are the other pieces of the treatment that maybe don't immediately come to the mind when you think about the stereotype of this type of work?
Yeah, we're focusing on relational aspects, connection, what their family makeup looks like. Maybe it's a genogram to kind of understand their family history a little bit more, going, like 3 generations, back to like understand the story in a more contextual way. It's talking about like their communication styles, their relational styles. And even for those that might have a trauma history, talking about that and how that's shaped and formed their thought patterns and how they got to where they're at.
And even doing trauma work,
Yes.
like true in-depth trauma work with many of these folks.
Yeah. you were sharing earlier too. It's a culmination of forensics and mental health work at times. And so we're not just focusing on the sexual forensics pieces. We're focusing on the impulses that got them there in their anger, or the depressive pieces and anxious pieces of them, or whatever that mental health aspect of their struggles is. We're focusing on that too. I try to make it very apparent when I'm working with guys that, sure, this forensics piece is a part, but it's not all of you. And it doesn't define all of you because of that. And so we want to make sure that as we're having this time, that it's helpful for you in those forensics pieces as well, but that we're also treating you as the full you rather than this part of you.
Definitely. And I think something too that I find like great about the curriculum that we have is that we also focus a lot on things like consent and boundaries and things like that, but not just in the space of sexual relationships. We talk about asking for consent from your parents to go to a friend's house. Like, how do we take the concepts that are inherently, yes, related to a physical relationship with another person, but also be able to apply that in elsewhere in your life, just to make not only your sexual behaviors healthier, but just anything that you go out and do healthier.
Truly, those topics should be talked about in any mental health treatment, like any mental health treatment with adolescents. I do not understand why consent is not a important part of any human sexuality curriculum. Like any ninth grade health class, consent should be a topic.
Can't imagine how many juvenile clients we wouldn't see if that was talked
If
about.
they fucking did. Like if you had just a conversation about how do you determine what the sexual boundaries are within a relationship. And from my perspective, you should be able to talk about sex long before you're able to have sex. Like if you can't talk about it, you don't get to do it yet. There should be a test. Like a talking, there should be some, like a driver's license.
In our juvenile curriculum book, I think it's chapter 13 has the "Are you ready for sex yet?"
Yes.
It has a test. At the
It
end.
does. There is a test. Yes.
There is a test. There is a test.
Yes, and you're going to get questions like, how much is a box of condoms versus a box of diapers, you know?
I brought in one of my favorite things that I do is I brought in the birth control side effects packet from a birth control packet. So whenever I'm describing here's the different types of birth control, did you know that there's no birth control for men? Would you like to know why? And then I open it up and I'm like, when you have a wife or a girlfriend or whoever later who is complaining about some sort of thing, this might be the reason
Well, you know,
why.
they tried to develop birth control for men.
Yeah, and they can't because they can't handle the side effects.
But the men kept opting out.
And I'm like,
Sorry, Micah, we're not picking on men here. That's a different podcast.
it is hilarious, I think, to watch, especially my juvenile boys, be like, oh my gosh, that's all side effects? I'm like, yeah. I'm like, but this is
Up to and including death.
Yes, exactly. But it's such an important piece, when you're just talking about developing relationships with other people, talking about sex and whether or not you're ready to have it. If, just like you said, if you don't know about it, you shouldn't be doing it. So if you don't know what condoms are, what birth control is, what any of that is, then you shouldn't be doing anything.
And talking to your partner, let's say you talk about sex, you are ready to have it, you do have consent. Then there is the piece of deciding what are the limits and boundaries of that sexual relationship.
Absolutely.
And what are the expectations. And I would argue that at least a percentage of our juvenile PSB clients, but even a light smattering of our adult forensic clients as well, their offense comes from a consensual sexual act that turned non-consensual because they went outside the bounds of what was agreed upon within that relationship. And I often, in doing this work, believe they did not intend to go, they weren't oh, this is the point where I'm really going to hurt my partner.
Yeah.
But they had watched porn, they had watched movies, they had talked to friends, and that these behaviors were part of the constellation of behaviors that others engaged in sexually. And, that's why we probably shouldn't have sex education be porn. But having those conversations are important. So, yes, we talk about it in treatment. We should be talking about it in health class because it protects both boys and girls. But as long as we're not going to do that, because we won't, we'll continue to do it in treatment retroactively. But a proactive approach would be great, world.
Yeah. Oh, go ahead.
Oh, sorry. Something else that we talk about is family culture, values, rituals, beliefs, so the family culture and the community. And so I think that that's an importance, like what are the inherently learned practices of sex through, like family values or things that have been taught. Like when I thought about that when you were talking about the genogram, right? And like the intergenerational patterns. And when you really go back, and you talk about where did you learn about sex? How did you learn about consent? How was this modeled to you? And oftentimes there's a lot of misrepresentation of like what is healthy, like healthy intimacy, healthy boundaries. And so I think especially with our juvenile population where like they don't have fully developed prefrontal cortexes, right? And so they're learning about sex through porn or through a peer. And so not only is it the family values, but the community in which they're ingrained. So their friends might say like, this is okay. And it's going to lead to greater problems for that individual client, or they may have seen a friend get away with it, which then normalizes it, right? And but then they don't get away with it. So, and I think something else that I like to talk about is like, again, like what is normal versus like what's concerning versus like what should be treated for. And so there's some really great resources out there to be able to look at like what is normative development? How does that align with the family culture values? And then like what is concerning maybe should be a topic of discussion versus like when should they kind of pull us in as treatment providers or other resources and supports.
Yeah, and I was thinking about whether they're in the family-based setting or outpatient, like Kim said earlier, we're trying to work ourselves out of a job. So, while at some points we are providing some psychoeducation around sexual development and sex education, that's not our role. Like we want the parents to be able to get to a space and a place that they can somewhat comfortably, because it is an uncomfortable topic, be able to be a space where their kids can come to them and have those tough conversations. And as a mom and now a grandmother, trust me, I understand how uncomfortable those conversations are, but we have to have them because yes, porn is not the best educator. And unfortunately, kids are getting exposed on average at age 8 to pornography. So we have to get ahead of that curveball and have conversations at pretty young ages with our kids. Where age appropriate. But a lot of parents, they're struggling with that, right? Because I come from a generation, your parents didn't talk to you about sex. So, that was a very strong thing that when I had my kids, I wanted to figure out how to have those conversations. So I came into that role after having all those conversations with my teenage sons at the time. So, and a lot of times it was, in the car, driving.
I don't have to make eye contact.
I don't have to make eye contact.
And they can't escape.
But yes, they can.
Intentionally trapping them.
Intentionally tracking them, but not looking at them.
Right. While driving a vehicle down the road, yes. Somehow that seemed to take out a little bit of the uncomfortability for me is to be able to talk in that space. So I try to help coach and parents to be in a space to not be reactive when the kids are bringing some really concerning content to them. But yeah.
But that's so much better learning in the uncomfortable car than learning from porn. I mean, because you've got these kids who normalize the behavior, and for the most part, and as sad as it is, watching porn is incredibly normal in adolescent, juvenile children, and so you've then got this like side world that's going on that they have absolutely no room to process. And then eventually through prolonged use of that, it's then this like pornographic overlay into the real world, leading a lot of the guys that we see into that. And so like, again, if we had conversations about it, so much could likely be prevented or at least discussed in a way prior that would allow for a better understanding.
And safer behavior. I
Safer
think what we
behavior.
underestimate, and the research, certainly we could bear to have more research in the area of adolescent problematic sexual behavior because it is more limited than would be helpful. But one of the number one predictive factors of problematic sexual behavior in adolescence is unsatisfied sexual curiosity. I can't tell you how many times I've sat across the chair from an adolescent who is a puddle, by the way. Like, these are not those like stay hard, like what do you do with hood rat shit with my friend? These are not those kids, right? These are kids that have had everything taken from them. They are humiliated. Now they don't get to talk to their mom in a car. I'm sure that would be their preference. Now they have to talk to some random ass professional in an office and talk about, and so often their little voices and their little puddly selves are like, I just wanted to know. I was just curious. And like some version of that response or that answer. And if we can have these conversations with them and support them in understanding those pieces, and they are so uncomfortable. Like, my boys are 7 and 9 right now. We're having those conversations a lot more than I would let. My mother-in-law called us the other week, and she's like, you should probably have the sex talk with them. And I was like, we do all the time. She's like, well, they keep asking me questions, and I want them to stop. All right, refer them back to mom and dad. Refer them back, but like, they really want to have these conversations. I do worry about what they might be bringing up on the school bus or at the playground. But at least they're factually accurate. So when I have that angry parent call me, at least I'll be like, well, at least it's factually correct, right? But yeah, having those conversations, never easy, always necessary, because curiosity tends to be a risk factor for some of these kids.
Yeah. And when I talk about like working with the caregivers, like the confidence and like I need to have this conversation, the confidence in being able to like go into the space, even though uncomfortable, like I think working with the caregiver on being confident and going into the space.
And regulated.
And regulated, yes. That's like that that commercial, right? And she's
Yeah.
like, okay, you can
Okay,
do
Sandra,
this.
take a breath.
Yes. It's time to have the conversation. And so I think intentional practice, right? And so working with caregivers on saying porn, saying pornography, saying masturbation, saying the words, right, that maybe they've never really said out loud in, even like a serious context, right? And so being able to help them come up with how they're going to approach the conversation. And it doesn't have to be reassuring them that they don't have to do a 45-minute lecture on sex. So they need to go in and they need to just do the little and I do the same thing. I trap my kids in the car. And because again, I don't
Follow
have
us
to look
for
at
more
them.
parenting tips.
That's another podcast.
Yeah.
Oh my goodness.
But yeah, and so because we don't have to look face to face, I think also parental agreement, that both parents are on the same page. Because I'm very open in the work that I do, and I sometimes forget that my husband is not, and so he's puddling just as much as the kids are puddling, and so I think working on that co-caregiver alliance, we've gotten better because. I've noticed because I will look over and be like, oh, because we're not making eye contact with anybody when we're having those conversations in the car.
I drive separately now.
Maybe that's why. I'll meet you there.
I think it's important to mention, though, that these conversations are not just protective when it comes to children and problematic sexual behavior.
Yes.
I think the human brain was not made. We have not evolved for the human brain to benefit from the constant exposure to novel pornographic stimuli that's presently available to individuals. I think the algorithms for some of these different pornography sites are designed to keep you on the page and clicking and constantly giving you new and novel stimuli to keep you engaged. And I think the research suggests that just like scrolling TikTok for hours is not great for the development of the human brain, nor is watching pornography for many hours. I think it also allows our children and adolescents to come to the caregiver if something horrific happens or even something risky starts to emerge. So I think that AI, there's a whole new world there in ways in which our children and adolescents might be perpetrated against. And if something like that were to happen to my kids, I want them to know that if something weird surrounding sex happens, you can talk to mom. You can talk to dad. You can bring that to us and we will help you and we will protect you. If an adult does something that makes you uncomfortable, talk to mom, talk to dad. We will help you. We will protect you. I don't care what that adult tells you. And my kids know that about me. They're like, Mom, if anything weird ever happens, we're going to tell you because we know that you'll kill this person. I will. I got you, boo. Like every time. And I think especially online, we're now seeing like some of those phishing schemes that say like, give me $5,000 or I'm going to send your teachers what your face looks like when you masturbate. Kids may not be aware that I got that exact email not that long ago to my work email. And it's like, ha ha, you don't have that. So there you go. Like, but kiddos exploring their own bodies and exploring the internet may be less confident and may find themselves victimized by some of those different schemes and plans. So I think it's not just PSB that these conversations benefit.
It's interesting though, because I feel like I've noticed a little bit of a shift with the connection between social media and pornography. I was recently watching another podcast that was an ex-porn star talking about the ways that they would bring people into it. Yeah, and it's interesting to hear more now how social media is specifically at times used as an advertiser for pornography, where you can very easily click on a Linktree link that takes you directly to it, where you've got these people that are like wearing skimpy clothing or guys and girls that are interacting in funny ways online that then we're like, oh, I want to know this person in a different way. They go to the link that is very readily accessible and then are into a world that OnlyFans or straight up.
The other one that I just saw, not an only, it was for minors. We talked about it in the JPSB. It's an OnlyFans that's non-pornographic, but you only have to be 12
Oh my goodness.
to create an account, but you have to be 18 to subscribe to that account.
That makes a
Shoot,
lot
and I
of
just,
sense.
yeah,
Makes a
doesn't it
lot of
just feel like the
sense.
place predators go? Like Omegle, like these things have been around forever. They keep shutting it down. I can't remember the name of that
I can't either, but
specific
I
one,
know
but
exactly what you're talking
I
about.
remember reading about it and being like, is this real? And it started out on a documentary I was watching about like YouTube kids and like the dark side of kidfluencing. And then it went into those different pieces. So I'm mindful of the time. I want to make sure we get to our last question here today, which is, how do you as a provider tolerate this type of work? The work we do is hard, as we've already established. We don't only talk about sexual offense behaviors. We talk about the whole sphere of the human experience. But we do also talk about sexual offense behaviors, and we sit and we listen to narrative versions of individuals tell their stories about how they've abused and harmed others as an effort to support them in creating safety and recognizing their patterns and how to avoid those in the future. And the work is hard. So how do you tolerate the work, and what mechanisms do you have in place to support you in developing a sustainable forensic practice?
yeah, I think it's gonna be different for everyone. But for me, a few things come to mind, and one is, I rely heavily on my husband. I mean, I'm not sharing explicit details with him, but he knows when I've had a particularly emotionally heavy day or mentally taxing day working with this work, and so he knows like how I might respond when I come home at night, and giving myself time to relax and just enjoy a great fun like sitcom or something like that doesn't involve any of the work I do, because when I leave work I really try to leave it at the door and not bring it home. But also, my granddaughter, she's amazing. When her face lights up when I come home, I'm like, okay, the world isn't completely dark, and there are some very light things out there, and great human beings to be around. And so I just love spending time with her. And those are the things that kind of keep me grounded while I do this work.
I think There's a couple of things. I mean, one of the things we've already talked about is the importance of supervision. And so being able to I mean, I can remember very specific times where I just was like, what the heck did I just sit through?
What did I just hear?
Oh my goodness, yeah. And I have felt a lot of comfort in being able to take that to someone else and talk about where the parts of my story might touch with parts of their story, and how I can practice that being aware of myself in order to help myself, but also then in tangent helping the client. I also think, Carrie, you said separating work and separating home, which at times is difficult, especially since my home is very close to my work. But that separation is so important, and having very specific ways of caring for yourself. Like one of my things that I like to do that I need to get back into the consistent practice of is woodworking. I love woodworking. It's so much fun. There's not a whole lot of thinking in it, and I can just put on a good podcast and just go out to the shop. So having those specific, or being outside is another one. I like being in nature. There's very specific things that I can take advantage of my time out of the office to rejuvenate myself and bring me back to be able to start well in the next week.
Yeah, I think for me, I'm very fortunate. Carrie's door is 2 doors down from mine.
I miss that.
Yeah.
I miss that.
So if I have something like particularly taxing, like I know that I can, if her door's open, like because she leaves her door open if she has the time to talk, I can go down there and the 5 steps that it takes, and talk to her. But I also have a wonderful relationship with my LPC supervisor, who is like always readily available for me to reach out to. And I'm also very fortunate to have a husband who is very supportive of the work that I do. He is very like all about the pro-social aspect of it, and he's very like community safe. We want to have kids one day. We don't have kids now, but making everything safer for other people inherently is going to benefit us too as we get older and we have a family of our own. And so he has been a wonderful support for me. He's hilarious. So usually he's like, "You had a bad day. Let's go get your favorite food. Like, let's get Red Robin, Texas Roadhouse, whatever." So like I'm very lucky to have easy access to people who are so incredibly supportive, that this is the work that I chose to go into. I also read a lot of romance books, which brings kind of a positive.
Romance books about dragons or just general romance?
Mostly hockey players, if I'm being honest with you. But yes, dragons too. But I find that it brings like a positive light back to like romantic relationships and things like that, and that kind of keeps me balanced to know that like I'm bringing people to a space where that's a relationship that they're going to be able to have, is like a healthy relationship with somebody else. And so it's just kind of a little like pick me up that I do if in between sessions I need it, or something like that.
I would say supervision, training, and research, amongst like the other things that you've all said. Like, I have a really great support network around me. I have, like my intentional things that I do with my family. I have like my own intentional, like as I'm driving home, like I'll usually put on like some kind of like music or something that will like help me just like kind of disconnect from the work, so that way I can go home and like be present. And usually I can be, it's usually like during the quiet times, like, after the kids go to bed and like you're just like kind of sitting there like recapping your day, that it will start to kind of creep back in. And so for me, a lot of it is like diving into the work so I can again like build that confidence, and that like I'm giving the best that I can to the clients that are present in front of me, and so like I'm doing my part in what they need amongst kind of all the other parts that everybody else offers. So I think for me, just going back to like the research, the knowledge, the data, and I'm kind of probably a little like nerdy in that way. It's like, oh, I had a really bad day, so now I'm gonna go like, read more about it. But
I
think it really
self-soothe
helps me.
through like facts.
Yes.
Like sometimes data can be very comforting.
Yeah.
Sometimes it can be very dysregulating as well. But
Yeah.
in this content area, it's often quite comforting.
Yes. Yeah. So that's how I maintain and sustain through the work.
I think I do a combination of what y'all have mentioned. I think definitely that disconnection piece, getting outside. For me, it's the chicken chores or going on a nice long hike with my dog. Just being alone for me is really important and restorative. I also think humor. I don't know, like the preposterousness of the human experience. And I want to be really clear, like I'm not making fun of the client, I'm not making fun of the victim, but I'm zooming out and being like, look at the brain and how ridiculous the brain is to have this individual come into my office and genuinely believe that the 2-year-old was coming on to him. And like that's not I'm not making fun. The situation is not funny. But the preposterousness of the human experience, like,
Absurd.
it's just absurd. And if you cannot take a moment and just reflect on the absurdity of it and like go to a colleague and be like, oh my goodness, can you believe this? Oh my, am I crazy? I don't feel high. Is that what is happening? So I think that's part of it. And I think humor, I think we have to laugh or we cry. I think sometimes it's okay to cry. So for me, that's a big one. I also think regardless of how you feel about this population and whether or not they should be in our community, they are. Regardless of whether or not you feel as though they should be released from prison, they will be. Regardless of whether or not you think they should still be alive, they're gonna be. So I sort of see it as something that over the years I've sort of seen as my, I don't know if life's mission, life's work, that feels really big. I don't know if it's that, but I do see it as my responsibility as a woman who's had many of the experiences, many of the non-preferred sexual experiences that women tend to have while not identifying as a female that falls in that 1 in 4. And I think there is a benefit. I think there's a huge benefit to men doing this work, but I think historically this has been considered men's work. Certainly when I came into the field, all of my mentors were dudes when I started working in the forensic field. We had like 6 male forensic clinicians and I observed and followed them all. But when I first started doing this work, women didn't do this work. It was a male dominated field to address male sexuality. Now, we know there are women that struggle in this area. We know there are young girls that struggle in this area, and that young girls who struggle in this area tend to be the least served population, truthfully. But I do believe that there are benefits to female treatment providers doing this work. And so once upon a time, that really just became very heavy on my heart. And I live in the communities I serve, and I have kids, and I am a person, and I want these communities to be safe. And so while it's not, I never set out to be an expert on sexual offending behaviors. It just sort of happened. And then when it did, I was like, you know what? I'm glad it did. And I want to carry this forward. So I think grounding it, all of that to say, I grounded in my why. That's my due north, is to create effective programming for this population in central Pennsylvania. And thanks to all of you, I'm able to do that. So thank you. So as we wind down, anything left unsaid? Any take-home messages? I started this journey about 21 years ago, and while I never did it on purpose, I would do it again. What's y'all's take in this space?
I think for me, my faith is a very strong component of my life. And just like in society at large, we do not talk about sex or sexuality or behaviors, sexual behaviors. In the faith community, it's even less. And I'm seeing a shift in that. And so, there are those of us providers who can integrate, a person's faith if it aligns, and incorporate the spiritual side to the work. I know that was something that I wrestled with when I came into this work, is how do I integrate my faith values alongside of this work? And the reality is, I feel like I am called to, quote unquote, the least of these. And this population is very much like the scarlet letter on their chest, with the way that the law works.
Or at least their picture on the internet.
Yeah. And forevermore, especially if they're an adult. And so a lot of times they struggle themselves, like with how to, even if they had the same faith background, So, I say all that to say, like, there are those of us who do this work that can help others who are struggling with problematic sexual behaviors, or if they've gone to the point of having an offense, and that there is help out there. So.
Yeah, I mean, what I'll share isn't anything new, and I think we've touched on it a couple times, but I feel like one more reminder is not going to change it, but will hopefully bring our attention back to it. Is just we need to talk about it. I mean, that's the purpose of us gathering today. It's a conversation that needs to be had, and it's a conversation that shouldn't just be secluded in the world of treatment. It's a conversation to be had in your families. It's a conversation to be had in your faith. It's a conversation that's necessary, because it's the things that we ignore often that lead us to the largest problems that we struggle with. So if this is something that we're going to continue to ignore, well, it's sure as heck going to stay a major problem that we struggle with as a country, but also in general.
I think like something that I think that's important to keep in mind too is that we all enter this field for one reason or another. Either whether that's we experienced similar things that our clients have gone through, or we felt similar emotions, like using that as a method of remembering that these people are human. Like we all are just human beings that are trying to exist in a world that it makes it so difficult to be able to do so in a healthy and effective way. And so like drawing back on that, like you said, that why am I here? Like I came into this field with the intent of helping people, and that is exactly what I'm doing. Like no matter what the population is, like these are human beings who are looking for help, and I'm doing that. And that is the only thing that I could ever want for that why for my life when it comes to my career, is to be able to be a person that can help someone, even if like I can't change the world, but I could change someone's world. Like whether that's the person who was the victim or the community, whatever it may be. I'm doing my why every single day when I show up for work.
Well, not only do you help the person in your office, but when effective, you support countless future victims in not having that experience. Like I don't know, I think pretty early in doing this work I realized like wow, like there's like for therapy, biggest bang for your buck I think you can get when it comes to eliminating human suffering. Like truly, but you don't get to know those things, right? We can't measure the absence of, but I think when done well, holy cannoli, just think of the prevention. Think about the lives served and changed, not just the individual in your office, but anyone they could have come into contact with after they leave your office. And to me, that's huge.
Yeah, absolutely.
Yeah. I think my why is always meeting people where they're at. And so no matter what's kind of brought into the context of the therapy space, being open and willing and ready to treat the presenting need. So it's kind of my why. My why is also just advocacy, knowledge, understanding, and humanizing each person, no matter what challenges they're presenting with.
Well, thank y'all. Thank you for joining me here today. I deeply appreciate you allowing me and being a part of like furthering this conversation. How to Be Happy Hour has a couple upcoming pods scheduled. So our next pod, we're coming back into the studio to look at the importance of drug and alcohol treatment. So we did forensic here. Drug and alcohol will be next. We are also going to spend some time taking a really hard left after that, looking at cousins. We're talking about cousins. Cousins are great. So I'm really looking forward to that. And I'm doing a very unique, or that's a more unique setting in that we are going to have a full panel, as we usually do. But one of the panelists will actually be my cousin, so who happens to be a social worker in New Jersey. So she's going to drive up for it. And we're going to talk about the role of cousins. So other than that, if you have any questions for a future panel, please feel free to submit them at Kim at howtobehappyhour.com. But otherwise, we thank you for listening, and we will catch you next time.